Welcome, everybody. I'm Jean-Paul Lim. I am the co-founder at Ageless Living. Thank you for joining us tonight. Today, I'm going to give you a presentation and education on hormone balancing. Today's presentation will explore the importance of maintaining hormonal balance for general well-being and maintaining your vitality. Whether you're here to learn more about managing your symptoms, improving your energy level, or simply looking for ways to optimize your health, I'm excited to guide you through that journey and give you hopefully some information that you can go home with. So sit back, relax, and get ready to discover some of the keys to unlocking a life of vibrant health and vitality. So to begin, I'd like to introduce myself. So as I mentioned, I'm Jean-Paul Lim. I'm a medical doctor. I did my training, my medical school training and internal medicine specialty at UBC. I then did a fellowship in echocardiography and in longevity medicine. So in addition to that, I've also explored other ways to help improve our wellness through medical cannabis, through medical psychedelics for mental health. And so I'm looking always for ways to combine different avenues of the medical field together to be able to provide people with holistic care. My passion is in preventative medicine, and I enjoy using a multidisciplinary team. So I enjoy not just working alone, but to be able to utilize the expertise and skill of different specialties to be able to deliver a holistic care to patients. Under my guidance and expertise at Ageless Living, our group of physicians, naturopaths, nurses, nutritionists, coaches, aesthetic specialists, and support staff, we all work together as a team to be able to provide patients with a thoughtful and personalized roadmaps to health and wellness. Our mission is to reverse biologic aging and to minimize the future risks by utilizing cutting-edge technologies and treatments both internally and externally. So today we're going to talk about one thing that I'm very passionate about and I think is really important and not talked about enough, and that's about hormones and hormone balancing and what that all means. So, hormonal symphony. I'm going to talk to you about the truth about hormones, what they do, what they don't do, what symptoms they may be associated with. So, just generally to lay the foundation, what are hormones? Essentially, hormones are a substance that's produced in one part of the body that has a direct effect on another part of the body. It helps to control our bodily functions, okay? It's vital to our health and well-being. It's responsible for our balance, okay? What's called homeostasis. Hormones can be given either the traditional route, which is, I put that in quotations, which is what we tend to give in allopathic or Western medicine. And then there's bioidentical. And what the difference is, because you may have heard this, is bioidentical means that the chemical structure of the hormones that you are being prescribed is identical to what your body makes, rather than similar. And the way that I usually compare it is as like a lock and key. Okay, you can have a key that sort of fits in the lock, but it doesn't turn, right? And those are, you could consider traditional. Some traditional don't even fit in the lock, but that's a different story. Whereas a bioidentical is the same key that you get cut, and it goes in, and it turns, and it unlocks the door. Okay, and that's important. The one that I always like to pick on, because it's the one that was most prevalently used, is Premarin. And some of the women here may have been prescribed or maybe attempted to be prescribed Premarin. And what most people don't know, because nobody tells them, is that Premarin actually is not only not bioidentical, it's not even from it's from a horse. It's from a pregnant horse. And so essentially they take the urine of a pregnant horse and it's got like 20 plus estrogens in it. And some of them sort of fit a woman's estrogen receptors. Okay? And the idea is if it can sort of fit, it can sort of modulate the symptoms. But obviously and I'll touch on that later on, there are consequences to that when it doesn't quite fit. Okay. As I mentioned, hormones are vital for our overall balance. Okay. Aging, both internally and physically, are highly dependent on your hormones and maintaining a balance. And I'm going to keep saying that. There's a few words that I keep saying, like bioidentical and balance. The body, as we know, as anyone here probably knows, through the years is in a state of balance. And when things get out of balance, that's when you realize that something is not quite right. Okay, and so it's important that when you're looking at hormones, that that you have an understanding, and that we have an understanding, that it isn't just one thing that you want to treat, that it affects the hormonal cascade in general, and that it needs to be balanced as a system. Mental health, and I'll touch on this with especially this as there's a lot of women here in the audience, is highly dependent on things like estrogen and progesterone, which is why its incidence goes up so markedly around the time of perimenopause and menopause. Your metabolism, gaining weight, right? As we enter andropause or menopause, andropause being like the male version of menopause, you realize you gain all this weight and it doesn't come off, right? And people just say it's because I got older. Your energy and self wellness and self-awareness and well-being. And again, that homeostasis, that balance, right? Where you just don't feel like you should, right? And that's the hardest part, because most of the time we go to your physician and you can't really say you just don't feel right. I know, because I don't like hearing those words, because I don't really know what that means when someone just doesn't feel right. But sometimes that's really all that we feel, right? And a lot of times that's what the beginning signs of a hormonal imbalance. So very quickly, what are some of the signs to think about? Because if you don't know what to look for, it's really hard to know to seek help. And I use women as an example of this all the time, because women, much more than men, they tend to have their symptoms normalized. And when you have something normalized and enough of your friends have the same symptoms, then you begin to think and assume that it is a normal symptom and that it is not anything that needs to be addressed. Okay? And so this slide is meant to empower you and educate you to understand what symptoms could be from hormonal imbalance. And I'm not going to say everything is from hormonal imbalance, but certainly poor energy and fatigue could be, although it's not always just that. Lack of stamina, motivation, mental wellness, especially around the time that your body is changing. Anxiety and depression, sleep, concentration. A lot of people complain of brain fog. Brain fog was actually something that only made it to mainstream and people actually recognized it during COVID, because post-COVID patients, you had to describe the way that they were this cloudy mind. And so they said, oh, let's call it brain fog. And so now everyone seems to understand what brain fog is, but brain fog, really big. And then, things that I think that are not emphasized enough and sort of diminished in importance, like libido. Sexual health it's fundamental to human wellness, right? And so acne also could be a sign of hormonal imbalance, menstrual irregularity for women, right? And even some digestive issues. And again, this is not meant to say that if you have these, you must have hormonal imbalance. But if you look at this and you're like, I'm checking off a lot of them, then it may suggest that there is something that you may want to get your hormones looked at. So I look at the hormonal system as a cascade, as like a as a pyramid. Okay, you have the foundation. I use a pyramid or a building, and so to me, the ground level, the foundation is your adrenal glands, which predominantly makes cortisol, and so cortisol is the stress hormone. Okay, the stress hormone is what is needed during times of immense stress. Okay, think of the obvious example. Think of when back in the hunters and gatherer days that were in our human evolution, where you didn't have food or you didn't have shelter. Okay, so you had to stay awake, you had to stay sharp, you had to stay focused in order to go and get your food or build your shelter. Okay, but what it does is it suppresses what I consider the non-vital hormones, okay? Because it's a survival hormone. If you're not going to survive, there's certain things that you may not necessarily be thinking of, like procreating, okay? And so cortisol though, it's important to understand, it's meant to be a sprinter. It is meant to be given in short bursts. So when you don't have that food, you go and your cortisol may spike for 2 days, and then you go and you hunt, and you go and you gather, and then you have the food, and then you have this time of plenty, and then it's supposed to come down. Okay, what happens though, and that's why I give these pictures here. It's not that Usain Bolt has no cortisol, but it's like he is the example of how cortisol is supposed to be functioning, which is short bursts, then you stop. But the top picture here you'll see is a marathon runner. And how does that make any sense? Well, the way that we have evolved as a civilization is that we've turned sprinters into endurance runners and marathon runners. And what I mean by that is with the Industrial Revolution, and especially worsened during the digital revolution, is you get this persistent low-grade cortisol. Okay, and so what happens is that it doesn't spike like the way it used to, because we don't have to go and hunt and gather for our food for the most part, but it also doesn't come down. And so you get this sort of chronic low-grade cortisol, and what it does is it leads to chronic low-grade suppression of your other hormones. And then over time, it becomes symptomatic. Your body can no longer keep that balance, and you start displaying some of these symptoms. Okay? And that's where you may have heard of these phrases like adrenal fatigue. The next one is sort of the thyroid. And the reason that I put this in as sort of the next floor up above the foundation of the cortisol is because the thyroid hormone is what controls your body's metabolism. Okay? And so it controls like the basal metabolic rate and how many calories you burn at baseline and how energetic you are. Okay? And so you can imagine during times of stress, you want to sort of preserve, you could think of it this way, you want to sort of preserve the function of the body, and so you want to like reduce its metabolic rate by 20 or 30% because you don't have any food, right? And so you're sort of in this conservation mode. And so what happens again with long chronic suppression or chronic elevation of cortisol is that your thyroid function gets suppressed. And that in combination with the cortisol acting upon itself may have direct impacts on things like your weight and your ability to get weight off and your energy level. Okay? And so some of the things to think of in thyroid dysfunction is, if it's low, you get anything that sort of sounds like your metabolic rate goes down, you gain weight, you feel cold, you get constipated, your skin is dry. And then the opposite, if it's too high because it's dysfunctional, is you can lose weight even though you don't want to. And then you're always hyped up and sort of on edge and have palpitations and shaky. The next step above that is your sex hormones and your growth hormone. Okay, and so this is things like your estrogen, progesterone, testosterone, and growth hormone. And they have overlapping symptoms. Okay, and so oftentimes people have a combination of the two, like a dysfunction in their sex hormones and in their cortisol, and in their thyroid. And so it usually has symptoms such as fatigue, sleep, anxiety, motivation loss, and brain fog and libido. And it's important, again, when you look for trying to balance your hormones, that it isn't just one. If you're dysfunctional in one, you have to ask the question, like, why did it become dysfunctional? And then how do I address it? Because it didn't just happen on its own. Okay? And so, again, it's important to look at the whole picture of the hormonal cascade when you're looking to get your hormones treated. Right? And so these are just some of the symptoms. You could see that fatigue is there. I mean, it's there all the time. Sleep, is there. Brain fog. It's sort of a common thing. Okay? And so those are non-specific symptoms, but again, could be a sign of hormonal deficiency. The other thing that I think is really important when looking at hormone optimization and balance is this idea of normal. And, admittedly, going through all of my medical training here in BC, it didn't really explain to me this importance, okay? And it took me years, actually, to really realize how important this was. And that's the idea of normal range. So everyone here has probably had some type of test before, right? And the test, usually when you go in to see a physician, they just look to see which ones are flagged, okay? And so you usually come with a complaint, and then your complaints of, say, fatigue, and they will run some blood work. And then they just quickly look, and they're like, Dook, nothing flagged. You're normal. Okay. Well, what does that mean, especially when you don't feel normal? Okay, and that's the idea of normal range. Normal range is not based on a person. Like probability. Probability is not based on a person. Normal range is based on a population. And it's an important distinction because a population is like, for instance, men's testosterone. The normal range is between 9 and 29 in most labs. What does that mean? That means they took people from between 18 to 65, and they said, and they asked them certain questions, and they say, you're pretty much a typical male, okay? And so then they say, okay, well, what's your testosterone? And they said, okay, well, your testosterone is this, and then they take 2 standard deviations past, and then they say, okay, well, that's normal. Okay. But what happens if you are like a really active, highly competitive athlete, and your testosterone normally runs a little bit outside of normal at 30 or 31? And then 10 years later, when you're not quite as physically active and you're burnt out and you've competed for so long, you've got all of the stress, and you're like, I don't feel that great. I don't have the same drive. I don't have the same libido. I don't have the motivation. And you go to your doctor and he's like, I think there's something wrong. And then they check you, and then they're like, nope, you're normal because your level is 21. And they say, well, there can't be anything wrong. But the problem is that that's not where you were, right? And that's the problem with normal. And that's the problem with looking at a number and not bother asking the patient and correlating it with symptoms. That's why I'm a little bit old-fashioned, and I still believe in talking to people and asking them how they feel, okay? Because it's important. And that's important to learn about normal ranges, because people could be within normal and still be abnormal, depending on where they started. Now, ideally, of course, we test people every single time, every year, right? We check all their blood work every single year, and we just map it out. And then we can see whether you've declined or whether you've increased. But that's not the way that we are. Okay. Bioidentical, I sort of touched on this. I did touch on this, but I just wanted to show you the differences between these. So here is, here's Premarin, which is, like I said, the horse estrogen. And I know in general, when you look at this, you're like, oh, kind of has the same hexagonal shape. It kind of looks the same. And you're right, it does have the same kind of hexagonal shape. But there are these extra double bonds, and the chemical structure is just totally different. Okay, so if you looked at it in a three-dimensional configuration, it doesn't even look remotely the same. Okay, but parts of it may bind to your receptor, and then it can modulate some things, but then it causes problems. So I wanted to talk about some of the production. Okay, so testosterone production in women, for instance, predominantly made in both the ovaries and the adrenal glands. Okay, and so this is just a picture to show that it is under control. All right, so you see these arrows, these blue arrows, they sort of go in a circle, right? And so it feeds back. Okay, so when you're low, when your hormones or any levels are low, the body senses that and says, hey, let me try to stimulate that organ to make more of it. Testosterone in men also controlled in that same sort of feedback, but a little bit easier in that it's actually only created in the testicles. Okay, so I like to think of us men as way simpler than women. And we are. Physiologically too. So that's hormones. And I wanted to leave it at that. And I didn't want to get in too much depth because it could be very overwhelming. But key things: balance, bioidentical, and what is normal. I think those are sort of the three key things that I want you to get out of that hormone. The other one is sexual health that I wanted to touch on, which is a service that we provide here at Ageless as well. And this is mostly we're focusing right now on women's sexual health. Part of that, honestly, is again, the simplicity of men's sexual health is a little bit more straightforward. Women are much more complicated. Okay. And that's not in a bad thing. That's not in a bad way. It isn't in a bad way, but it is important to recognize the differences. Okay, because again, I'm not trying to minimize anybody's experience, but it is complex. So again, sexual health is something that is gaining a little bit more media attention now in terms of how important it is to not just our mental well-being, but our overall physical and general well-being. Okay, and again, it's not really something that people necessarily want to talk about, but it's important. And if you don't talk to your physician about it, then you're not going to talk to anybody about it. And so by nurturing good sexual health and identifying it as an issue, we can begin or begin to heal that part of our wellness. So this is my colleague in Kelowna. So her name is Dr. Tracy Lotz. She is an expert in women's sexual health. So she's been in practice for 19 years, both as a physician, like a general practitioner and an emergency room doctor. But she's always been interested in women's health in general, women's sexual health, and in longevity. And so she does hormones, but more I want to introduce you to, because she travels to she'll travel here to our Langley clinic, she'll travel to our Victoria clinic, and she's based out of our Kelowna clinic. But she is one of the few practitioners in the world that is certified in the Bader Institute for women's sexual health procedures. It's a famous women's sexual health clinic in London, England, where she was trained. And I'm going to go through some of I'm going to highlight a few of the areas that she is an expert in. So she is A4M trained, which is American Academy of Anti-Aging Medicine, which is where I received my longevity fellowship. She's got advanced menopause training, trauma-informed practice from her emergency room experience, and LGBTQ safe. So cosmetic gynecology is kind of this new thing. It's more openly discussed in Europe, certainly where the Bader Institute heralds or situated in, but also in the US. But to talk about it here, it's important because it's not just for cosmesis. It's not just, you think of this and you're like, oh, cosmetic gynecology, well, what am I going to do? It has a functional purpose, not just a cosmetic purpose. So it could reduce pain, it could prevent injuries, it could prevent recurrent infections, and even things like inability to control your urine, like urinary incontinence. Again, all really important for women's health. One of the therapies that I want to highlight that she does and she has training in is the O shot, the G shot, and the P shot. It's all variations of the same technique where essentially we use plasma-rich platelets to infiltrate or to inject the clitoris, the G spot, and the head of the penis. And it improves sensitivity. Other slides. There's actually two other ones that she does. I'm going to tell you the other two. I don't know what happened to those slides, but I'm gonna leave it at this questions. But I'm going to. How do I start the slide? How do I restart this slide? This thing? No. Tools, view, slideshow. There. Okay. Was there a toggle up there? I didn't see it. Okay, so before we go to the questions, the other two procedures that I wanted to highlight for women's sexual health is a superficial vulvoplasty, which is a recreation of the vulva of the vagina, for people who may have a prominent vulva that becomes painful or that becomes irritated and dry because it chafes and rubs. So again, minimally invasive. You don't have to go to the operating room for this. And then red light therapy. Okay, so red light therapy into the vaginal vault that helps stimulate secretions and lubrication, and it helps with things like dryness and tightness. And sometimes when the vaginal vault gets dry, it can prolapse and it can cause recurrent urinary tract infections and honestly pain when during sexual encounters. So those are the procedures that I wanted to highlight that Dr. Lotz is able to provide to our female patients.